The state of Idaho ranks dead last when it comes to the number of pediatricians per 1,000 children across the state. According to the American Board of Pediatrics, the national average is about 90 pediatricians per 100,000 kids. Idaho well behind that number with only 42 per 100,000. It isn't a new problem for sure, but one that is now being addressed. This week, the Family Medicine Residency of Idaho announced for the first time in state history there will soon be a pediatrics residency in the state of Idaho. It's a big move. And Joe Paris spoke with the program director of the new pediatric residency for insight on the program and how it can help fill the gaps.
The place where pediatricians can be helpful, certainly pediatricians can provide outstanding primary care also, but it's really providing support and diagnosis in challenging children, children with special health care needs that have complex illness, et cetera. Those are the ones that are having more difficulty potentially obtaining optimal access to care.
And when there's not optimal access to care, there are certainly consequences.
There absolutely can be. And that can range from delayed care, it affecting school performance and well-being, and can also, one of the things, again, family physicians do a great job with this, but we know that where there are pediatricians, there tend to be higher immunization rates. So that's an area that has always been strongly supported by pediatricians throughout the country. Why start a pediatric residency here in Idaho? There's a couple of reasons. Number one is that we know that about 60%, on average, 60% of graduates of a residency program will stay within the area after graduation to practice. A second reason is that there is not a single pediatric residency that exists if you drive east from Portland and Seattle until you hit the Minnesota border if you stay north of Salt Lake. So for the entire northern third of the US, we go 1,400 miles with no pediatric residencies even existing. So there is no training to allow people to stay locally thereafter. There is no pipeline of pediatricians coming into this area.
Because I know through the pandemic, there's been a conversation that, there's a lot of things that we need to address in the Idaho medical system with so many people coming into the state. And then we see kind of how the load of COVID patients impacted the healthcare system statewide. But this type of investment into pediatrics and into the medicine community in Idaho seems significant to me.
Yeah, I think it is significant, and I think it's going to be really beneficial. One of the things that we know about all residencies is it's not just about the residency, and it's not just about the residents who stay. It really is an opportunity to bring in additional resources, grant money to improve or develop programs, et cetera. A great example of this is that we also in Idaho are at the very bottom in the US in terms of rates of pediatric psychiatrists per 100,000 children. And we're in the midst of this pandemic pediatric mental health crisis and don't have the pediatric psychiatrists around to serve them. One of the things that having a pediatric residency along with a psychiatry residency that already exists here, what we can then develop is a pediatric psychiatry fellowship, which would be, again, a new resource, allow for more access for pediatric patients who have psychiatric needs, but train people to remain and practice here afterwards. One of our goals in this pediatric residency is going to be sending our residents out. They'll be required to spend a 2-week block during their first year and then a 4-week block during their second year and again during their third year in a rural setting.
And it seems really significant that you're going to get residents in these rural communities working in a spot that you highlighted that may not have a pediatrician available all the time.
Absolutely. We're really going to aim to develop in concert with our state family physicians a model of a consultative pediatrician like exists in New Zealand and in Sweden and Norway, where it might not be the pediatrician being the primary care provider because the family physicians want to continue to be the primary care provider for the kids, but a pediatrician who is able to go from area to area and provide on-the-ground consultation for the challenging cases and to support those family physicians in the care that they provide their more complex children.
All right, we're told program leaders they're going to work to piece everything together in the coming months here. The goal is for the program to host 4 residents per year through its 3-year residency, which is a total of a dozen residents in the first 3 years, just doing the math. First class expected to begin July 2023.